The following program is a Town of Colonie television production of the William K. Sanford Town Library.
I'm Mary Rozak, the Director of Communications for Albany County. This is Albany County News. In the next 28 minutes or so, yes, just under half an hour, we're going to talk about something that is extremely important, an association that is in our backyard that deals with all kinds of issues related to something very important in your body, talking about your heart. And joining me today, we have two folks who are integrated into the very fabric of the American Heart Association, Kathy Lanni, Board President, and Dr. Mandeep Sidhu, the Chair of the American Heart Association, the Capital Region Advisory Board. Welcome.
Thank you.
Thank you.
We're going to talk, let's talk in general a little bit about the American Heart Association. It's, it's come a long way. I think when people hear the American Heart Association, they're not quite sure. They know it has something to do, as I started out, with your heart, maybe people who have heart attacks, but it's not your father's American Heart Association. This is a brand new kind of metamorphosis. Kathy, you want to tell us?
And heart disease is not your grandpa's illness anymore.
Mm-hmm.
It is the number one killer of all Americans, certainly now, unfortunately, the number one killer of all women as well.
Mm-hmm.
So I think the Heart Association has really tried to be an advocate. When you recognize that 80% of heart disease is preventable, we want to get that word out. We want to educate people to take better care of themselves so that heart disease is not our number one killer anymore. So we definitely have come a long way.
You've been involved with the Heart Association for quite some time, and it's very personal for you.
It is.
Tell me about how you got involved.
In 2009, my youngest daughter, Erin, who was 18 at the time, went from her regular pediatrician transition to the adult doctor, I'll call it, and was found to have abnormality in her heart. And through tests, we found out she has a condition called third-degree heart block, which is really an electrical malfunction of her heart, where the upper and lower chambers, and Mandeep, correct me if I'm wrong, don't communicate. So her pulse at the time was about 38.
Oh, wow.
We thought she was typically, teenage tired, college tired, but in reality, she was literally failing, and we had no idea. So Erin needed to have a pacemaker. So came home from school on a Friday for spring break and leaves on that following Friday with our hearts in our throat, recognizing that she was clearly at risk. So we're very, very appreciative of the American Heart Association and their work. Frankly, they're keeping her alive.
Doctor, how typical is a story like that?
So in a young individual, that's quite rare, actually. So complete heart block, often you'll hear about in elderly populations, octogenarians, nonagenarians, who have the natural pacemaker cells in the heart that just no longer function. Occasionally, younger individuals, you'll see patients with Lyme disease who will develop complete heart block, but it's, what Erin suffered was less common. And having an invasive implant placed in your heart with leads and a generator battery device for an 18-year-old is a major life change, especially when it's life-sustaining.
I want to get to that in a second. You said something about Lyme disease. So Lyme disease can cause issues with your heart.
So Lyme disease can. There are many manifestations that are non-cardiac of Lyme disease, but one of the cardiac manifestations is heart block and advanced heart block. And so we do, at this time of year, we do see that in the hospital with patients who come in with manifestations of Lyme disease.
Well, that's the first time I've heard that connection, so that's what caught my ear. When we're talking about someone as young as Kathy's daughter with a pacemaker, I mean, I know there have been great advances, but I'm assuming the pacemakers need to be replaced. I mean, what is the life cycle of that, and what your daughter has to face?
So the battery life has improved greatly. Technology has advanced greatly over the last 30 years, and fortunately, the battery life, depending on the utilization and how much the patient is dependent on it, can last upwards of 10 to 12 to 14, 15 years even. And then the leads, which connect the pacemaker, which sits here in the chest cavity down into the heart, also have a lifespan of their own. So it's the battery generator that's typically the first concern.
Is that considered as something major every time you need to do some kind of replacement?
So in our world, now that we are able through technology to implant aortic valve replacement through catheter-based therapies, a pacemaker implantation is considered quote-unquote minor. However, if you're the patient or you're the mother or the father, it is anything but minor, and it's still an invasive implant, and in medical terminology sometimes referred to as minor surgery, but by no means is it minor for the patient or the family.
As a cardiologist, what are you surprised that you hear most often from people that may come into the office, come into the hospital setting? You're at Albany Med. What surprises you when something that someone might say? So
what surprises me most in the clinic setting is that patients are aware of their family history. They're aware of risks, but yet they are not certain about what actions they can take. They're often asking about things that we at the Heart Association talk about frequently: blood pressure, blood sugar, cholesterol. But then it's just being busy in life and having, it's not as easy as it sounds in a 30-minute visit to talk about lifestyle modification or optimal medical therapy as we do in research, but actually living that out and finding time for an active lifestyle or finding time to make healthy food choices is not as simple as it can be. And then there are other patients who are completely not knowing of their family history or their background and are presenting with some symptoms. And often when you look back upon their family history, you'll gain some insights, or their personal history. The development of diabetes and obesity has become an epidemic, and so that's often surprising to patients. How big a role does stress play? We live in a very stressful time, and with work and everything that's coming together. And we talked a little bit about this before the camera started to roll. How big a factor is stress? Stress is a major factor, and stress is an underappreciated factor. So, you'll always hear a discussion about diabetes. You'll always hear a discussion about hypertension, about high cholesterol, about genetics. And then there are risk factors that are not the major risk factors, such as rheumatoid arthritis or HIV, other inflammatory conditions. And stress is often left out, but when you get to talking with patients, often what's driving some of their symptoms can be emotional, financial, personal stress throughout life. And there's been research through the American Heart Association and through other groups that have looked at stress and personality type. And there's still work to be done there, as there's been a debunking of the once thought in 1982 there was a publication that type A personality may be at higher risk. And now it's found that it's... I hope not, because I'm a type A personality. Ditto. And now it's thought to be more about how stress is handled and whether you internalize that stress and continue to struggle with it, or whether you externalize it, speak about it, share it, cope with it, manage it, and try to minimize that stress. And so that's more critical, especially in the times that we live in, where there's a great deal more electronic abilities, but there's also a great deal more multitasking, and that human interaction is hard to replace when you're trying to express what creates stress in your life and why you feel that emotion. But there's absolutely no doubt that there's a strong link both between depression and heart disease, as well as anxiety and heart disease. I'll tell you, I know what creates stress in my life. It's about this big, rings, dings, and gives you access to everything, but at the same time demands your attention 24 hours a day. Do you hear those kinds of things? Now, I mean, I would say years ago, and as we're saying, this is, heart disease and heart issues are not your grandfather, the same as what your grandfather had. Are you hearing that more of that is related to job and work and technology and those kind of things when it comes to lifestyle? Yeah, it's rare in the office setting. In the hospital setting, occasionally patients will, when they say, well, my blood pressure's been perfect and my blood sugar's perfect and my cholesterol is well controlled and LDL less than, let's say, 100 or even less than 70, blood pressure of less than 130 over 90. And then you start to delve, and there's no family history, mother, father, siblings, and then you start to ask further questions to try to understand what else could be placing this individual at risk. But rarely do folks get into the the nuances of what brings that stress unless it's something overt. And often I can tell you in clinic you see much more anxiety than, because that's a place that's safe. They're there with myself, a medical resident, a medical student, and they can express themselves and not be worried. And it's sometimes interesting to see when someone will come with or without their family, and how much they'll express about the stress that they live with to us in a private relationship as a doctor and patient.
Let's talk about the Heart Association and awareness and some of the other things. I know that the first thing that comes to mind when the doctor talks about being more open when family may not be around. Are there different kinds of support groups and awareness and things like that that the Heart Association offers or has or encourages partnerships with?
Well, we have a very, very active cardiac kids program, and so you have the child who certainly has the heart issue, but then you also have the stress that brings to the parents. So I think they're unto themselves our support group. That's probably one of the strongest that I've seen here in the community. And certainly other organizations or other groups do talk about stress in a variety of different ways. I mean, if you think about the number of book clubs that have come on board, right? So that's a way to relieve that stress. But it's you know, as they call it, FOMO, fear of missing out. But there's also fear of keeping up, and so you feel like you constantly need to be on, and that is a stress unto itself. And then you begin to, at least, you know, for women especially, it's that I feel inadequate. They're going to find out that I'm not as good as I say that I am. And so there's all that additional stress and pressure to try to make sure that everything at work and or at home, or the combination thereof, is working or flowing in the right way. So there is a tremendous amount of stress, as you had said, on people. And how do you manage all that and then find time, as Mandeep said, to take care of yourself, to do that 20 to 30 minutes of exercise, to make sure that you're able to prepare and shop for a healthy food choice versus on the way from a practice or all the other things you've got going on, whipping through the drive-thru to make sure you have something to eat versus nothing. And we all do it. I'm not sitting here saying that I haven't done it myself. So it's really finding that balance. First of all, recognizing that you do need to put yourself in the mix, and then finding that balance to say, hey, wait a minute, I have to take care of me, because if I don't take care of me, I won't be around to take care of everyone else. And that's the reality.
We should next time book the program and have treadmills in here so we can do
Right?
28 to 30 minutes.
Exactly.
While we're
Talking
doing
and walking.
our exercising. Greg would love that for sure. That would pose some taping issues. When I'm talking about support and we're talking about women in general and you're wearing red, there are all kinds of things that the Heart Association does in terms of Go Red for Women, Better You. Let's talk about some of those programs and supports and encouragement for women.
So the Go Red for movement has just taken off like wildfire, which is exactly what we want. I say it's, you know, the red dress is certainly the sign of Go Red for Women. I say it's not a red dress event, it's a red dress alert. The fact that, you know, when you look at Title IX, right, you look at equality for women, this is clearly not a way that where we wanted to achieve that, and unfortunately we have. You know, I don't know the statistic, Mandeep, you can share it, but when women come to the ER with a heart attack or a feeling of a heart attack or a heart condition, most of them come dead on arrival. So I don't know what the statistic is there, Mandeep.
Yeah, there's a great deal of underdiagnosis. So, you know, we often talk about how women are always caring for everyone else around them first. And the red tie, like the red dress, it's just in a matter of awareness. But the underdiagnosis and the undertreatment, you know, putting everybody else first, I always remind my female patients that if something happens to you, you won't be there to care for those loved ones that you always put first. And being a little bit selfish for your own heart and for your own health is probably the best, not only for yourself, but for those loved ones. But there is, as Kathy's mentioned, there's been research over now 4 decades showing a consistent pattern in cardiovascular medicine of underdiagnosis, whether that be stress testing, whether that be cardiac catheterization, whether that be bypass surgery. And some of that is hard to understand. There are patient factors, there are system factors, there's a great deal of quality improvement related health services research that the American Heart Association funds to try to understand these differences.
When you say underdiagnosis, symptoms? And I know you said there are a number of factors, but is it because women are not as forthcoming to say what the symptoms are to get the proper diagnosis?
Well, first and foremost, women may have different symptoms. So they may not have, as many patients will say, well, I saw this television show, I saw this movie where this elderly gentleman was clutching his chest and having the elephant standing on the chest. Women can often have atypical, what we consider in the medical terminology, atypical symptoms of shoulder pain, back pain, abdominal pain, nausea, fatigue. Some of those are very nondescript and you could feel on any given day from a non-cardiac perspective. So, often we talk about diabetics and when the elderly considered octogenarians or nonagenarians as having these atypical symptoms, but women often will present with very atypical symptoms themselves. And that's something, we were just at our heart walk recently and we had a woman there who developed classic, substernal chest discomfort. And that was alarming and that was something that could be handled, but often if you feel something nondescript, you won't know, is this meaningful to get evaluated immediately? Is this something that I can call my physician about? And so we always try, both in heart attack and in stroke, to try to raise awareness about the symptoms and to try to encourage folks to not only know your numbers, but know your body so that when that time comes, you don't delay care.
Okay, and I don't mean to be flip about this, and I think we need to underscore, which is why I'm going to bring it, and you basically just said it, but, I'll have shoulder pain, I'll have back pain, I'll feel nauseous. Like you said, that could be just, any number of things. At what point do you say, this is something that I need to talk to a doctor about? I mean...
Right. So we will always encourage, first, knowing yourself and knowing your body, knowing your numbers will give you an assessment of risk. But at that time, if it's something that is out of the ordinary for you, and if you don't have an orthopedic shoulder injury or you haven't had back pain or trauma, the first evaluation is something you don't want to delay. And once that diagnosis or evaluation has been made, it's non-cardiac in nature, then you can follow up with your primary care to receive more evaluation for that non-cardiac. But often in what we call, quote unquote, the ST elevation MI or the massive heart attack, time is muscle. And the blood flow to a territory of heart muscle is dependent on the arteries that supply that blood flow. And in that type of heart attack, it's a 100% flush occlusion. And that muscle is starving, and that's why typically the nerve endings will create the sensation of pain or pressure, but sometimes it can be burning. And we often see patients in the hospital who delayed coming. Oh, I thought it was the tomatoes. I thought it was the pasta. I thought it was, and not only until 3 or 4 or 6 hours later when the pain persisted, did the patient, man or woman, say, oh no, this is different. This is not GERD. This is not reflux. This is not all of the other things that can cause that. So at first, we always encourage, if it comes to your mind, especially now with both the emergency department, but also with urgent care.
That's what I was going to say. What do? Do you go to urgent care?
So if it's more classic and really we want people in the emergency department because they can get up to a cath lab immediately. So if 911 is called, which is what I always encourage, because no matter how fast you think you can get to an institution, the ambulance will get to you faster and they can start the evaluation in the field and they can activate the cath lab from the field through the emergency department. And that's a very powerful system which Kathy and colleagues from around the region have been working together to improve, as well as nationally, we call Mission Lifeline. So that's why I always encourage patients that if it's something serious, you feel it, call 911.
I know.
Nobody wants to do it.
Nobody wants to do it.
You know what? I'm listening to what you're saying. I'm saying, okay, there's someone out there that's watching and saying, okay, then maybe what if this happens again? Maybe I should go and have it checked out. But I don't know if it rises to the occasion of calling 911. I don't know it. I mean, I hear what you're saying. Right. You're just saying go.
And I say go. I say go because the best thing is to get there and to know that this is something else. But if you don't make it there, or last year in America there were 476,000 sudden cardiac deaths in 2017. If you are one of those 476,000 people, you would have rather, and again, this is why I brought up there are other venues such as urgent care. If you're really feeling like, oh yeah, I know I pulled a muscle last week, but it's persisting, you may go to that. If you're feeling burning chest chest discomfort under your sternum and you're feeling sweaty, that's a 911 phone call. But I think if you've
Well, I
never...
think the sweaty just added a different component.
Yes.
That I think.
Yeah, but I think
that I agree.
if you know your body, if you see a primary care physician, if you have risk factors and you see a cardiologist, you will be much more aware. I have patients who are waiting in my office who see the material on the wall who will say, I never thought about jaw pain as being an equivalent for heart attack.
I wouldn't have thought of that either.
Right. I never thought about left arm, or actually that's a fallacy. It can be either arm, but left arm pain as being an equivalent. So that first time, especially if you don't know your risk, you don't want to try to be the physician. Get to where you can be safe, get to where you can get the care you need, and then if it recurs, you'll have a different sense of understanding of what it is. But it's really important not to delay care.
I'm talking today about the American Heart Association with Dr. Mandeep Sidhu and Kathy Lanni. Kathy, let's talk also about Better You, because that's something that's
Love this
been
program.
several years now, right?
Several years, yes.
4 years, 5 years? I can't. I'd have to refer to my notes now.
I
but
think it was started in 2011, actually.
Wow,
And
longer
what
than I
Better
thought.
You is a program that takes a dozen or so women and takes them through a 12-week program, a combination of exercise, education, and really transforms their life. This is not a weight loss program by any means, although that very often becomes a side effect of doing some of this work. But it's really meeting the woman where she's at and then educating her on certainly her risk factors. There's an evaluation, but also on how to change her lifestyle to become a heart-healthy lifestyle. And the difference you see in these women, certainly from a health perspective, but also a confidence level, is just amazing. It's the highlight of the Go Red for Women luncheon. I've had the opportunity to meet several of the women before and then after. And, you know, they say things, for the first time, I'm proud of myself, or the first time in my life I've ever taken care of myself. Or they go and take the nutrition class by Ellie at Market 32 Price Chopper, and they learn how to shop healthy. And they say, I've never realized how to do that before. It's really, on one hand, it's amazing, but on the other hand, it's kind of sad that how did we allow this to happen in our lives, right? And so I think when you see the before and after, the transformation of these women, many were on blood pressure medication, no longer need that. They've been on, you know, using insulin for diabetes, they no longer need that, or they need a lower dose. So you see the health benefits of just that 12-week period of time to devote to taking care of yourself, the camaraderie, the friendship, those are lifelong benefits, but just to see the transformation of these women is unbelievable.
And it is wonderful when women are actually, they're filling out the applications, they're being selected, and then they come together, and that class is really like a family.
You know, when I think the program first started, we had maybe 30 or 40 applications. I think this year we had about 150 or more applications for the program. So it has taken on its own life, which is exactly what we want. You know, we want to see that. And it's so important to just get the word out, you know, certainly heart attack as well as stroke. You know, we are the American Heart and American Stroke Association, so to see these women truly transform their lives, which again then transforms their families' lives.
Right.
It's just, for me, I think it's their first step in their next life, in making the commitment, the desire to say, I want to be a part of this, and then when they're selected, to truly see the benefits of this program to them makes my volunteering here at the Heart Association worth every minute I spend.
There are partnerships with other organizations, and most recently the Lung Association, the Cancer Society, on issues related that impact our health, and one big one, Albany County tobacco. Albany County has been a couple of first and out in front and leaders. Why don't you talk about the exciting news recently with Albany County? I don't want to be touting our own horn as the Director of Communications, but why don't you talk about why the Heart Association is excited about that?
Well, you know, Tobacco 21, when you look at smoking, most people who smoke today, if you talk to them, they started when they were in their teens. So if we can prohibit the sale of tobacco folks who are not 21 or older, and or prohibiting cigarettes sale in our pharmacies. Those are two huge steps to making a lifelong difference for an individual. We don't want to encourage people to start to smoke. Smoking is the #1 killer or cause of heart, certainly not only heart disease, but also cancer. So I applaud the county executive for standing up to say we're going to be the first to do this, and now to try to bring it throughout the state. We are diligently making those phone calls, probably as we speak right now, to try to get this passed through. So it's truly exciting. We are hoping that this gets through, certainly on a statewide basis, but it is really the first step for Albany County to draw that line in the sand, to say we care about our young people and we care about the health of our county and the people in our county, and we're not going to have it in our backyard. So I just can't say enough about how happy I am about that.
And I'm sure, as a cardiologist, I'm sure you have been pleased.
I've been very pleased and very thankful, because seeing patients who come in who want to quit and have a difficult time, or patients who are not aware, and when I talk with them about the fact that cigarette smoking is as powerful a risk factor or an accelerator of heart disease and stroke as diabetes. Sometimes that is, but I had a patient who for many years I tried to counsel for 4 years and could not, and we tried every different possible technique, and at one point she came back in 2016 and said, "Dr. Sidhu, you're going to be really proud of me today." And I thought, "It's terrific," and I heard that she'd quit, and I said, "Please tell me, because I'd like to learn. What did it?" Because
Sure.
we tried everything, including sitting on a quit line together. She was one time the last patient of the morning, and we sat in the quit line for 20 minutes together. And she realized, boy, he's really serious about this. We're now 12:30, 12:45, and it turned out that it was her 6-year-old granddaughter.
Really?
Who came home and said, "Grandma, you're going to kill yourself." And that really shook her. And the granddaughter didn't just say it and walk away. She persisted.
Wow.
And it's been now over 2 years, and it's great to see her. But more importantly, I think, as Kathy mentioned, we at the Heart Association had the opportunity in May to visit the State House, and there's 50 colleagues from all over the state, and talking with leaders and legislators about how important this is, just delaying that, because I learned that day that it's the 18 or 19-year-old who buys and then supplies the 14-year-old. And there's a great deal of benefit that can come not only from lung cancer and heart disease, but also from stroke. The American Heart Association, American Stroke Association are one, and I think that we often talk about the heart first, and as a cardiologist, I can understand that, but I think it's important that we realize the risk factors are very similar, and there's a great deal of overlap. So delaying smoking onset or preventing someone from developing that behavioral and chemical addiction is probably the greatest gift that we can give to neighbors, friends, loved ones, or family.
I think the commercials that are on TV right now are so powerful. The commercials where there's someone who is talking about not being there for his children, and at the end, he died weeks before the commercial was aired. Or when you see the commercial where it shows the actual organ, your lungs. And I did not realize that, when you quit smoking, your lung, you can regenerate.
Yes.
And so just seeing that, looking at those infected lungs, that's just horrible.
Well, it's amazing. It's amazing if you talk to folks who have quit, how they feel a week later, a month later, a year later,
Sure.
and 10 years later. There's definitely an evolution physiologically. There's definitely an evolution with smoking cessation. But really the key is to try to prevent youngsters who are so vulnerable from this addiction that is, and also can lead to other addictions in life. And so currently, I know outside of the heart and stroke realm, there's a great deal of concern with opioids, and these behaviors can lead to vulnerability for other addictions as well. So it's important to try to prevent our youth from developing these addictions.
Well, I thank you both. If folks want to learn more, they can go to the website, www.heart.org, to find out more. Thank you so much for joining me, Kathy
Thank you.
Lanni,
Thank you.
Dr. Mandeep Sidhu
Thank you.
from the American Heart Association. This has been Albany County News. I'm Director of Communications for Albany County, Mary Rozak. We'll see you again soon.